In 1996, Purdue Pharma, a privately owned pharmaceutical company controlled by the wealthy Sackler family, introduced a new prescription opioid called OxyContin. This drug was designed to manage moderate to severe pain and was marketed as a groundbreaking solution for millions suffering from chronic pain in America. But what set OxyContin apart wasn't just its strength, it was its time-release formula, which Purdue claimed made it less addictive than other opioids like morphine or codeine. To the public and medical professionals, OxyContin seemed like a miracle drug. The company ran an aggressive and persuasive marketing campaign, distributing free samples, sponsoring pain management seminars, and hiring a large sales force to convince doctors it was safe for long-term use, even for conditions like back pain or arthritis. Many doctors, trusting the data they were being shown, began prescribing it in record numbers. But this was only the beginning of what would become one of the most devastating public health disasters in American history. The truth was hidden beneath a web of misleading studies, manipulated data, and corporate pressure. OxyContin's so-called safety was an illusion, and Purdue knew it. At the heart of Purdue Pharma's success was not just the drug itself, but the unprecedented marketing strategy designed and pushed by the Sackler family. Rather than rely solely on scientific studies or independent medical consensus, the Sacklers turned OxyContin into a commercial product, selling it with the same tactics used by consumer brands: persuasion, repetition, and psychological manipulation. They trained a massive sales force, sending thousands of pharmaceutical reps across the country with one goal: convince doctors that OxyContin was safe. These reps were equipped with charts, graphs, and fabricated talking points that misrepresented the risk of addiction. One of the most widely repeated claims was that less than 1% of patients become addicted, a statistic that had no reliable scientific backing, but was printed in brochures, videos, and seminars. Doctors were offered incentives, free trips, free meals, and paid speaking engagements to prescribe higher doses. Purdue even created a list of high-prescribing doctors, labeling them as targets and pressuring them with more visits and rewards. This wasn't just about pain management. It was a strategic campaign to dominate the opioid market by overprescribing a drug that they knew carried lethal potential. The campaign specifically focused on rural and working-class communities, where physical labor often led to chronic injuries and pain. In these areas, doctors had limited resources and were easily influenced by the promises of powerful pain relief. Purdue's sales strategy turned trusted physicians into unknowing conduits of addiction, fueling a crisis under the illusion of compassionate care. Despite being marketed as a safe, time-released painkiller, OxyContin is a powerful opioid, chemically similar to heroin and morphine. It binds to the brain's opioid receptors, dulling pain while producing intense feelings of euphoria, especially when taken in large doses or altered for faster absorption. And while Purdue Pharma promised that its time-release formula would reduce the risk of abuse, this claim quickly proved to be dangerously misleading. Users discovered that by crushing the pill, they could bypass the time-release mechanism entirely, unlocking the full dosage of the drug at once. This made it incredibly easy to misuse, and equally difficult to stop using once addiction took hold. Unlike other prescription medications, OxyContin didn't just relieve pain, it rewired the brain, creating a fast, powerful dependency that many users were unprepared for. The drug was often prescribed in high doses, even for relatively minor injuries or pain conditions. Patients who followed their doctor's instructions found themselves needing more of the drug just to feel normal. Tolerance developed rapidly. Some patients, through no fault of their own, went from legitimate medical use to full-blown addiction in a matter of weeks. When prescriptions ran out or became too expensive, many turned to cheaper street alternatives, such as heroin or fentanyl, to feed the same craving. The addiction cycle that began in the pharmacy often ended in the emergency room, or the morgue. The Centers for Disease Control and Prevention, CDC, later confirmed that prescription opioids were a primary driver of overdose deaths in the United States during the early 2000s. The addictive nature of OxyContin was well known to Purdue Pharma, even during the early years of its release. Yet the company continued to push the narrative that the drug was safe when used as directed, ignoring growing reports of dependency, overdoses, and abuse. This calculated denial allowed the crisis to spiral further out of control. As the opioid crisis deepened in the early 2000s, more attention turned to what Purdue Pharma knew, and when they knew it. Investigative journalists, legal teams, and whistleblowers began uncovering internal company documents, emails, memos, and training manuals that painted a chilling picture. Purdue was not just negligent. They were fully aware of the addictive potential of OxyContin, almost from the very beginning. These documents revealed that Purdue had received numerous warnings, from doctors, sales representatives, patients, and even their own internal researchers, that OxyContin was being widely abused. Sales reps regularly reported back about patients crushing and snorting pills. Doctors flagged rising addiction concerns. Pharmacies notified the company about suspicious prescription patterns. And yet, rather than responding with caution, Purdue doubled down. Executives internally discussed how higher doses of OxyContin were more profitable than lower ones, even though higher doses were also more likely to cause addiction and overdose. In one email, a Purdue manager wrote, "We have to hammer on the abusers in every way possible. They are the culprits and the problem. They are reckless criminals." This attempt to shift blame onto patients and avoid corporate responsibility was a strategic move to protect the company's image and revenue. Additionally, Purdue trained its sales representatives to minimize concerns about addiction during conversations with doctors. They were taught to say that OxyContin had a low abuse potential and was less addictive because of its time-release coating, despite mounting evidence to the contrary. These deceptive tactics weren't the result of misunderstanding, they were part of a calculated business plan. Perhaps most disturbing was that Purdue's top executives, including members of the Sackler family, were frequently updated on the abuse reports and market feedback. Yet, no significant action was taken to reform the drug, change the marketing strategy, or warn the public. Instead, they continued to reap billions of dollars in revenue, while the death toll quietly climbed. What began as a prescription for pain relief quickly escalated into a national catastrophe. The aggressive promotion and widespread availability of opioids like OxyContin fueled a public health crisis that has devastated the United States for more than 2 decades. Since the late 1990s, more than 500,000 Americans have died from opioid-related overdoses, an astonishing and tragic toll that continues to rise every year. These deaths did not happen all at once. They unfolded in waves, starting with the explosion of prescription opioid use in the early 2000s. As OxyContin and similar drugs became household names, patients became dependent. When prescriptions were cut off or became too expensive, many people turned to illegal opioids, first heroin, and later, even deadlier synthetic drugs like fentanyl. The result was a deadly domino effect. Entire towns, especially in rural and working-class areas, were transformed almost overnight. Hospitals were overwhelmed. Emergency rooms saw a spike in overdose cases. Families lost loved ones without warning. Children were born addicted. The crisis didn't discriminate. It affected veterans, teenagers, office workers, the elderly. What made it even more insidious was that many of those who died had never used drugs recreationally before. They were simply patients, trying to manage pain. In response, the U.S. government declared the opioid epidemic a public health emergency. Billions were allocated for treatment and prevention. But the damage had already been done in many areas. The burden on law enforcement, healthcare systems, and social services became unbearable. Funeral homes in some states reported being overrun with overdose victims. Communities struggled to cope not just with loss, but with the stigma and silence that often surrounded these deaths. Despite the staggering human cost, many of the companies and executives responsible faced minimal consequences for years. The public grew increasingly outraged as the death count continued to rise, and yet the core systems that allowed it to happen remained intact. The opioid crisis wasn't just a tragedy, it became one of the defining public health failures of modern America as the opioid epidemic raged across the United States, claiming lives, destroying families, and overwhelming healthcare systems. Purdue Pharma was quietly amassing a fortune. Thanks to its flagship drug OxyContin and a relentless marketing machine, the company generated over $35 billion in revenue from opioid sales. This staggering figure wasn't accidental. It was the direct result of a calculated business model that prioritized profits over public health. Year after year, Purdue increased its sales goals, rewarded its top-performing sales reps with lavish bonuses, and relentlessly pushed higher-dose prescriptions. The company funneled its profits into expanding its influence, sponsoring medical conferences, funding research institutions, and making donations to cultural and academic organizations under the Sackler family name. This allowed them not only to profit from suffering, but also to polish their public image, making them appear as philanthropists while the crisis they helped create continued to escalate. All the while, communities across the U.S. were falling apart. The economic cost of the epidemic reached into the hundreds of billions. Local governments spent millions on emergency services, treatment programs, and foster care for children orphaned by overdose deaths. Prisons and jails filled with people suffering from addiction. Rural hospitals faced a tidal wave of patients without the resources to manage long-term care. And yet, even as lawsuits and investigations piled up, Purdue's leadership, including members of the Sackler family, continued to deny responsibility. Legal settlements were paid out, but for many, the damage was already irreversible. Entire generations were affected. In some counties, funeral homes reported more overdose-related services than anything else. Teachers dealt with traumatized students who had lost one or both parents. Local economies suffered as addiction tore through the workforce. What made it more enraging for the public was the growing realization that Purdue's executives weren't only aware of what was happening, they were profiting from it. This wasn't an unfortunate mistake or a tragic side effect of innovation. It was a well-documented consequence of corporate strategy. While mothers buried their sons and entire towns grieved their losses, Purdue's profit margin soared. The Purdue Pharma and Sackler family scandal wasn't just about a dangerous drug, it became a window into the dark inner workings of corporate America. The opioid epidemic revealed how easily profit motives could override ethics, how scientific data could be manipulated, and how corporations could weaponize trust in medicine to sell addiction in a bottle. One of the most disturbing elements of the scandal was how science was distorted. Purdue funded studies that minimized the dangers of opioids, selectively quoted research out of context, and published biased educational materials aimed at doctors. These materials were framed as objective, peer-reviewed research, but in reality, they were part of a calculated effort to mislead the medical community into prescribing more opioids. By sponsoring continuing medical education courses, Purdue created the illusion of consensus, that OxyContin was both safe and effective for long-term pain management, when evidence showed otherwise. The company also built deep relationships with regulatory bodies and medical boards, many of which were too slow or unwilling to act. Meanwhile, Purdue's marketing team worked relentlessly to control the narrative, crafting advertisements that showed smiling patients regaining their lives thanks to OxyContin, while quietly downplaying side effects and risks. They trained doctors to dismiss patient concerns about dependency as pseudo-addiction, a term invented and spread by the company itself. This wasn't just unethical marketing, it was a strategic psychological campaign, using trust in healthcare and science as tools of manipulation. Purdue Pharma didn't just sell a product. It sold a lie, and convinced an entire generation of doctors, patients, and families to believe it. And all the while, the Sacklers positioned themselves as generous philanthropists, donating to art museums, universities, and hospitals. Their name was engraved on gallery walls and wings of institutions around the world, even as their company's actions left a trail of devastation across the U.S. This scandal forced the public to confront a disturbing truth, that a well-funded corporation, with enough lawyers, marketers, and influence, could reshape public perception, rewrite science, and cause mass suffering, all while appearing legitimate and benevolent on the surface. The story of Purdue Pharma and the Sackler family is not just a tale of one company's greed, it's a warning to the world. It shows how unchecked corporate power, disguised behind polished marketing and philanthropy, can devastate entire nations when profit becomes more important than people. The opioid epidemic didn't begin on the streets, it began in boardrooms. And while some justice has been served, the scars remain on millions of lives. As we move forward, this dark chapter serves as a reminder. The next crisis may already be brewing behind closed doors, disguised as help and sold as hope.